My name is Kasim Ortiz, and I'm here with Dr. Bonnie Dern, and we're talking about how do community-based participatory projects start. And I was wondering if you could shed some light. Often we get questioned, well, where do you start if you're working on a CBPR project? And what would you say is the most important thing to getting people started?
Well, in our CBPR conceptual model, the first domain is the domain of context. And context refers to to broader forces that impact even the beginning of a CBPR project, like the ability of funding from NIH or foundations or other sources of funding to actually do community engaged research. Things like social and structural determinants and capacity to do community engagement, community capacity and interest in research, and also the academics' capacity to have a little bit of cultural humility and engage with communities and appreciate what they have to offer to the research endeavor itself. And then finally, the health issue of importance. And by that we mean, how can we structure our research questions in a way that really engages people in something they're interested in and passionate about, and that impacts them currently in their lived experience right now, and something that they want to really work on and engage in. So of course, context is the first domain of our community-based participatory research conceptual model. And it's an incredibly important consideration when we start to engage communities in research, because it draws our attention to just be cognizant of what has been the history of science or research in the communities that we're working with. So I really love to consider the impact of the context, the broader context, as we enter into relationships with communities. And we have 5 different dimensions of the contextual domain. And one of them is, what is the history of collaboration, the history of research, and what is the trust or mistrust that we begin with as we start to engage communities? And one thing, I think science is considered a universal good and, something positive for the populace, but we know in communities of color and that science was actually used as one of the most and strongest tools of colonization. Science back in the 1800s and early 1900s and up until actually the present day often would be used to characterize communities of color, particular communities, and any marginalized groups, LGBTQ groups or aged people or poor people, with characteristics that made them less than 100% human. And it was science that actually was the justification for some of the early congressional mandates that made people of color, less than human. I think African Americans were 5/8 human, and actually American Indians in this country weren't citizens until the 1950s. And so I think that a lot of communities, and we know about the Tuskegee experiment and things that happened in Indian country. We know, and from a more current historical perspective, that communities of color are pretty suspicious of the role of science in their communities. And this is the history that we have to name and deal with when we start to engage people of, conducting Western science.